Hi everyone, now we're going to be moving on to the third part in our rehab protocol here at Transformation Wellness Team, which is the wobble chair. It is going to be focusing on creating counter nutation in our pelvis and tailbone while also focusing on healing the disc in our low back called our lumbars. So you want to ensure that you're in the proper position with this one. Be careful getting on, it does move. Okay, we don't want anyone kind of falling off or hurting themselves. So once you get into this nice seated position, you're going to, again, like we did with the second part in our rehab protocol, make sure that your hips, knees, and ankles are at a 90-degree angle and they're nice and parallel. Feet need to stay flat against the ground. And you're just going to rest your hands on your on your thighs, just like this. What you're going to do then, we're going to start off with doing a side-to-side motion first. With doing the lateral aspects of wobble chair, just like this helps focus on the TFL, which is located right here, that then turns into the IT band, that is a little tiny band that then goes to your knees. So any kind of knee issues or knee focus problems you might be experiencing, this will help loosen up that ligament right there, and especially focusing on decreasing any kind of rotation you might be having in your mid back as well. So what you're going to do is you're going to sit nice and tall. You're then just, if you have to, place your hands on your hips to really focus on getting and focusing that motion in this pelvis region. You don't want to be going too extreme because then you're going to start hurting yourself and overexerting your body. These are nice and slow controlled movements. You're just going to go side to side, side to side, really feeling this. Again, we don't want too crazy of motions. You're just going to go side to side, just like this. Keep your feet flat against the ground. And this helps, again, focus on that TFL to IT region. Nice and controlled movements. Then you want to move on to the second part, which you're going to do is a front to back motion. So to show you more, we're going to go from the side so you can see this angle. Again, nice position. You're going to be sitting nice and tall. And what you're going to do, this one is going to be focusing on pumping the disc in that low back region. So what you have when you create a counter nutation between your pelvis and tailbone, this helps with cerebral spinal fluid, the CSF pump, in your body, which is constantly pumping. But most people now sit about 12 to 16 hours a day, which means you're not really getting any kind of counter nutation anymore. And so you're not pumping those discs. And we really want those discs to pump that CSF flow because then it can help with any kind of blood circulation, nutrients, and start healing the disc from the inside to out. So from front to back, what we're going to do, place our hands here. You're going to go forward and back, just like this. If it helps, I like to focus on your belly button. Go in, out, belly button in, and back out. Nice and controlled movements, just like this, front to back. So with wobble chair, you're going to start off with you're always going to do 8 minutes. So starting off, do 4 minutes side to side, 4 minutes front to back. Then once you start getting more advanced, you can start to do the figure 8. Figure 8 now incorporates both those movements into one. So you're just going to go hips forward, then back. Right knee, back glute. Left knee, left glute. Right knee, back, forward, back. Once you start to get more used to it, you can work up to getting it more flowed. Again, 8 minutes total. Focus on healing those discs, front to back, side to side, figure 8 once you're ready. Thank you.